My name is Yannick Stemmler and I am a resident physician at University Hospital of Cologne in Germany. Today, I would like to present a survey study we performed to evaluate chest imaging in high-risk hematology patients. The article Baseline Chest Computed Tomography as Standard of Care in High-Risk Hematology Patients has recently been published in Journal of Fungi. A little background information on the topic. Baseline-CT in asymptomatic hematology patients has been suggested for early diagnosis of invasive pulmonary aspergillosis. As you know, pulmonary aspergillosis has a high mortality in these patients and is still a frequently missed diagnosis. In 2 studies, radiological abnormalities at baseline were present in above 30% of patients. In these patients, the risk of developing invasive pulmonary aspergillosis was twice as high as compared to unremarkable baseline CT findings. 5% of the patients in these prospective studies were even diagnosed with IPA, invasive pulmonary aspergillosis, at baseline, and another 10% subsequently during hospital stay. So, the aim of our survey was to evaluate chest imaging in hematology patients in general and especially assess distribution of the use of baseline CT in hematology units all over the world. We designed a web-based questionnaire and invited colleagues from international scientific societies who are working with this patient population. Via the survey, we assessed estimated numbers of annually treated patients with acute leukemias, AML and ALL, and patients with allogeneic stem cell transplantation. Chest imaging time points and techniques were also evaluated, and the estimated rate of pulmonary aspergillosis per center was asked. In case pulmonary aspergillosis was diagnosed, we also asked follow-up imaging time points and evaluated these. The survey assessed chest imaging in general. However, we wanted to focus on the use of baseline chest CT scan, which was defined as a standardized chest CT at diagnosis of acute leukemia or a CT scan at hospital admission of an acute leukemia or an allogeneic stem cell transplant patient. Overall, 142 physicians from 43 countries participated in the survey, which you can see on this map, and 92 of these participants answered every single question with valid data. Most medical specialties who participated were hematology and infectious diseases, as one would expect, and the approximately annually treated patient numbers of their hematology units are displayed on this slide. Here we see the use of chest X-ray, chest CT, or no imaging at different time points a patient might experience during hospitalization. The most frequent indication for chest CT was persistent febrile neutropenia despite broad-spectrum antibiotic treatment, as one would expect. Concerning the use of baseline CT at admission, 24% of centers perform CT, and at diagnosis, 48% do so. For both time points, number of use of X-ray were higher despite being the inferior technique. Here we see the use of CT at diagnosis and at admission per disease entity. Of note, a CT is generally more often performed at diagnosis than at admission, which is displayed in the blue bars. Baseline CT, which is the gray bars, include both indications and is more frequently applied in patients with relapse disease and most frequently in allogeneic stem cell transplant patients. In total, an accumulated 56.8% of participating centers perform a baseline CT, so at any of the 2 time points for any of the disease entities. Furthermore, results show a slightly higher number of European centers performing baseline CT. The median estimated invasive pulmonary aspergillosis rate was 8%, and interestingly, this rate was higher in centers performing baseline CT. This suggests baseline CT being beneficial for detection on the one hand, and on the other hand, a detection bias when baseline CT is performed as a routine can be suspected. However, this difference was not statistically significant. Finally, and in line with international guideline recommendations, follow-up CT, if pulmonary aspergillosis is diagnosed, is performed in 98% of centers. In conclusion, baseline CT at diagnosis or admission is becoming a standard of care in high-risk hematology patients. Chest X-ray is still a widely used technique, and we suggest that randomized controlled trials are needed to investigate the impact of baseline CT on patient outcome. At this point, I would like to thank all participants to the survey for providing information. Thank you very much. If you want to discuss on this topic or contact us on our scientific projects, you may send me an email to my email address displayed here. You can text us via Twitter with the handle @fungiscope, or just write us a comment below this video. And don't forget to like, subscribe and ring the bell.